Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation. And with today's episode, we're teaming with PRC. This podcast is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. Today's podcast is going to be a special edition where we're wrapping up 2021 and looking forward to 2022. So joining us today is Katie Owens. She's the president and co-founder of the Healthcare Experience Foundation. She's been a familiar voice on this podcast. And today I'm going to ask her some questions about what we've learned in 2021. So let's start, Katie, with you recapping a little bit about the state of healthcare in 2021. And let's start on an optimistic note by telling us about what's worked for organizations in 2021.
That's a humbling question. And I'm thrilled to be back and thrilled to reconnect with our listeners. So oftentimes, as we're coming into the new year, organizations are saying, what's next? Where do we set our priorities and focus? And I know we're going to talk about that today, Casey. John Dewey, who's an American philosopher, has this amazing quote that we use a lot of times in our training and development work, which is the best leaders are the best learners. And this is an important time as we finish up a year and we start to look at the horizon at the next year and at 2022. And I know we all have a lot of grand hopes for a fresh start. Yet how are we taking this time to give reflection on the prior 12 months? What's worked, what hasn't worked, where have we grown, where would we like to see ourselves evolve in the coming year? And as I think about some of the trends that we're seeing across healthcare, we've had the privilege to work with some really extraordinary organizations. And I think the number one trend that we've seen among those that we have the opportunity to work with to advance the healthcare experience is going back to basics. And what I mean by that is for so long, you had care teams working on, let's say, air quote, patient experience tactics. And what we've really seen is that the tactics aren't really anything without the principles and the fundamentals. And we've seen organizations go back to focusing on restoring resilience and engagement. We've done some really exciting work, yet humbling work, when it comes to helping organizations recognize signs and symptoms of compassion fatigue and burnout and interject resiliency solutions. We've seen a refocus on compassion. We just graduated the first cohort of leaders across the country in compassionate leadership. We've seen a focus on restoring leadership visibility and rounding as a tool to support the workforce. We've also seen a need to get really creative when it comes to helping leaders manage teams that don't reflect the same stability that they did 2 years ago. There's a statistic we use in our training that 91% of hospital executives have had to hire traveling or agency nurses this past year due to the pandemic, versus about 60% of hospitals and healthcare systems using interim workforce back in 2019. So helping leaders with on-the-spot teaming and strategies to build a team while team members are constantly changing. And so those are some of the big trends that we've seen on the healthcare, resiliency front, and the need to focus on compassion and gratitude. From a physician engagement standpoint, we have the opportunity to work with over 150 healthcare organizations this past year to work on restoring physician engagement and loyalty. And the key trends that we've seen in that body of work is the need to focus for your medical staff around demonstrating an excellent patient experience, excellent nursing care, and building administration physician trust so that physicians feel that they are involved in strategic and operational decisions. And at the same time, we know this has been a tumultuous economic environment for hospitals and health systems. Kaufman Hall recently published that the average hospital is seeing a 55% drop in median operating margins. So trying to continue to advance excellent patient experiences, quality, an engaged workforce, all with having to get really creative and innovative with resources.
Definitely. And speaking of resources, I want to move this conversation into some of the hard truths that we learned in 2021. So please tell us about some of the recruitment issues that you've seen on the front lines of healthcare, and also what's going on with a lot of the turnover in regards to the great resignation that we saw in 2021.
Absolutely. We're calling this the Great Compression. We've done a lot of work helping frontline leaders focus their recruitment and retention efforts over the last 12 months. And what I mean by with the Great Compression is we're seeing a really stretched and strained workforce at a time when our volumes are regaining, when patient acuities are more challenging than ever before, especially due to delayed diagnoses. I mentioned a moment ago, 90% of hospitals are having to rely on travelers, agency staff members. 62% of hospitals have a vacancy rate higher than 7.5%. And so most hospitals are in situations where they're requiring and need support with different communication and teamwork skills and styles. Many have lost really tenured clinical managers. They're worn thin with emotional resiliency. At the same time, we know that physician engagement, a key driver, as I mentioned, is trust and confidence in the nursing care. So physicians are frustrated and concerned around quality. And yet, organizations need to move forward. Most leaders that we're encountering and the statistics are showing feel pretty used up at the end of the week. We typically don't feel energized come whatever our Friday is. And so it's really focusing on the staff that are still there, helping onboard and orient your traveling agency clinicians, your locums, focusing on healthy team dynamics and some creative onboarding strategies that we're seeing to help orient these temporary team members so that they feel equipped to be successful, to participate in the team, re-recruitment and retention of your existing staff. And hey, let's also focus on getting these temporary team members to sign back up with our organizations. Let's focus on retaining them also.
So what's some guidance you would offer for healthcare leaders going into 2022 to perhaps help set some strategies and priorities?
Through our partnership with PRC, I've had the opportunity at a few different milestones throughout the pandemic to do some national presentations and speaking around what we call when the patient experience shifts. How do we reset our baseline? What's the degree of variability we're seeing nationally when it comes to patient experience? And we have seen the highest degree of fluctuation in patient experience perceptions than we have in the prior years before the pandemic. And I would really encourage you as leaders and as team members in your organizations to answer a few key questions as you work to pivot forward. What are you proud of with the patient, employee, and physician experience in your organization over the last 12 months? What are the challenges that you overcame and how did you overcome those challenges? What are some ways that you applied speed to innovation? And what is it that you want to retain and broaden moving forward? Those specific questions are calibrated to help healthcare teams move forward beyond one of the most uncertain periods that we've ever experienced, and to recognize and seek out opportunities to duplicate and sustain those gains. In our experience, that's best going to be achieved through reflection and applying a critical but growth-oriented lens to learn and grow.
Katie, what are some of your hopes for 2022, and what are some reasons we should be optimistic in this field?
Dr. George Maisel, one of our physician coaches and leaders, has a great quote that never let a crisis not be a catalyst for great opportunity. And I think that there's a recognition more than I've seen ever before across healthcare teams of the purpose and importance of developing their leaders, staff, and physicians to support the organization to restore a focus around compassion. All of our mission statements at their core compel us to focus on compassionate care to patients and families. Yet what we've seen in our research and our programs this year is that we've almost neglected the importance of interpersonal compassion and emotional intelligence in our interactions with one another. That's one of the things that I'm most proud of in our work across our team and our partnerships, for instance, with the Maryland Healthcare Education Institute, that we've been able to restore that focus. And I can tell you, and I know we've got some upcoming episodes on compassionate leadership in the new year, that this is restoring a sense of purpose, a sense of intentionality in these interpersonal interactions. And I'm pretty excited to see where this goes in the new year.
And Katie, do you want to leave us with some thoughts on the importance of compassion, giving back, and gratitude?
Of course. So we've had a lot of opportunity to work with organizations this past year around restoring compassion, focusing on gratitude. The reality is suffering is pretty pervasive right now. Just think about across our listeners, across you and the teams that you lead, how many of you in the last 12 months have been impacted by a death or a diagnosis of a family member or close friend, loss of a job, pregnancy, marriage, friendship, sense of security and belonging, have had great fears about your health or your family's health, had sleepless nights filled with anxiety about, your children, your work, your professional careers, have friends or family in the military that are dealing with really difficult situations. The reality is we are all a part of this collective human experience, and gratitude restores perspective. There's a tremendous amount of great work and body of research, whether it's Brian Sexton's work on writing down 3 great things that happen to you at the end of each day, to writing gratitude letters to yourself that in post studies demonstrate perceived improved mental health. And so we could do an entire, podcast on that very issue. What we've been really focusing on is restoring self-compassion. How do we reduce our negative self-talk? How do we restore and infuse more civility? How do we empathize to see the perspective of other people so that we can respond with compassion? Whether we witness compassion, whether we are a part of giving compassion, we still get the same, mental health benefits and positive boosts in our brain hormones. And so as we close this year out, I hope that we will see much more focus of this consciousness that we are all experiencing some form of distress, and that we recognize that suffering, and that we move beyond ourselves to demonstrate that help and support, and that we at the same time respect and have gratitude and a deep appreciation for the skills, the strengths, the leadership attributes, the interpersonal attributes that we bring our best to, and that we respect ourselves.
And keeping with our theme of gratitude, Katie, why don't you tell us anything that you're grateful for as we close out 2021?
Gosh, I guess that is practicing what we teach. I have to tell you, much like many of the listeners, I'm extraordinarily grateful that my family is safe and healthy. Do not take that for granted. I am so grateful for the team that we have at Healthcare Experience Foundation, how we have just risen with a lot of agility to support the healthcare leader, staff, and physicians that we have the privilege to work with. I'm extraordinarily proud of our partner organizations that we have the chance to team with, and the organizations that we're proud to call our clients, and to see their focus and their creativity and innovation throughout these periods of uncertainty gives me so much to feel not just grateful, but truly joyful about as we close out this year and we move into what I hope are some bold goals for the new year.
Very well said. And of course, we're also thankful for you. the Healthcare Experience Matters podcast listeners, and we wish everyone a warm and healthy 2022. Joining us today has been Katie Owens, president and co-founder of the Healthcare Experience Foundation. Thanks again, Katie, for your time and for all the great information.
My pleasure. Happy 2022, everyone.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation, with today's episode teaming with PRC. To learn more, visit healthcareexperience.org. That's healthcareexperience.org.